I frequently find patients who come to my outpatient departments getting worried about kidney biopsy. So kidney biopsy is one of the important investigations which is needed for us when we are evaluating a patient with kidney disease. So if at all somebody develops a kidney disease or symptoms suggestive of a kidney disease, the first and foremost thing that we do is to get a good history, symptomatology from the patient, and also perform a thorough clinical evaluation and go through the past history of illnesses that he has. Following this, we come to some idea of what this person may be suffering from, and we order some investigations which can be in the form of urine tests or blood tests or some imaging, most probably an ultrasound examination of the abdomen, or sometimes a CT scan or a nuclear imaging. When we get the results of all these investigations, most of the times we have some conclusion of what this person is suffering from. But there can be a few instances where we may not figure out what this person has or what is the exact diagnosis of his kidney disease despite performing urine tests, blood tests, and scans. In such scenarios, we are left with no other option but to perform a kidney biopsy. Kidney biopsy is a very safe procedure, and at best, the safety is about 98% and the risk is about 2%. The risk is the risk for bleeding manifestations. But whenever we perform this biopsy, we evaluate the patient to see if he has an undue risk of bleeding. And we perform this biopsy only if we are very sure that the bleeding risks are minimum and something which we can accept. While we perform this biopsy, most of the times we admit this patient, we keep the patient prone, we target the lower pole of the left kidney with the help of an ultrasound. Initially, we give a local anesthetic, and following that, we put a needle and then take a small core of renal tissue from the lower pole of the left kidney. And this tissue is subjected to light microscopy, immunofluorescence, and sometimes electron microscopic examinations. And this examination provides a wealth of knowledge, wealth of information about what the patient is suffering and what is the stage of the disease that he has, and what are the best therapeutic options that we can offer to him, and what can be the probable outcome of this disease. So a kidney biopsy is a very safe procedure. Patients need not be scared of this. The risk of bleeding manifestations is about 2%, and most of the times you are discharged from the hospital after 8 hours or the next day. So whenever your doctor advises you to undergo a kidney biopsy, without any second thought, it's always better to undergo a kidney biopsy. But you can always discuss with him what are the pros and cons and what are the other options that are left in diagnosing your disease. But if your doctor says that biopsy is something which is essential, I would always suggest you follow your doctor.